Leader of the third party.
Thank you, Honourable Speaker. My question is to the Premier. Is he in favour of the rise of for-profit corporate healthcare delivery in British Columbia?
Minister of Health.
Thank you, Honourable Speaker. The answer is no, and that's why we have hospital employees union members in this House today who have seen what we did to repatriate contracts throughout the healthcare system. That's why in communities such as Dawson Creek, communities such as Telus, communities such as Williams Lake, communities around British Columbia, communities such as Surrey, communities such as North Vancouver, we're building health capital projects that are not P3s, that are owned by the people of British Columbia. That's why we work together with our province's doctors to change the way we pay doctors in BC, working together to ensure that that payment reflects the work done, reflects the care patients need, why we have continued to take steps, dozens of steps, to ensure a stronger public health care system and to work against, Honourable Speaker, the increasing privatization of the system, which is not good news for anyone. It's why we purchase private MRI machines. It's why we purchase private surgical centres. Why we've seen the largest, Honourable Speaker, increase in, Honourable Speaker, no staff. Honourable Speaker, they're yelling no staff. We did more surgeries in the last 2 weeks than we've ever done before, Honourable Speaker, in the public sector. And it's why we changed. Thank you.
Members.
Honourable Speaker, with respect to the Medicare Protection Act, we brought in regulations. We proclaim regulations that have been left unproclaimed for 15 years to strengthen the protection of public health care as well, and we're going to continue to do it.
Leader of third party supplemental.
Thank you, Honourable Speaker. Well, regulations to this government, whether it's regulations in environmental protection or regulations in healthcare protection, seem to amount to the same thing. Not much at all. We've heard over and over again from the minister. But my question was to the Premier, because under this government's watch, let's look at what's happening. Two-tier health care has been on the rise. While family doctors burn out in record numbers, some are choosing to charge for their services. Telus Health is charging upwards of $3,000 a year for access to health care, including access to a family doctor. We've been asking this minister about this since February, and it's always the reports coming, the reports coming. Shoal Health charges $2,400 a year. Beta Therapeutics charges $110 a month. More and more for-profit corporate clinics are popping up, and yet nothing has been done. Universal health care was a foundational principle of the NDP in Canada. One wonders what Tommy Douglas and Dave Barrett would have to say about the conditions under an NDP government in BC today. My question is to the Premier. Will he stand up and tell British Columbians his position on for-profit two-tiered healthcare in British Columbia, and whether that is the future that he sees for this province?
Members. Minister of Health.
Honourable Speaker, I'm opposed to extra billing for medically necessary services, and the Medical Services Commission has been taking action again and again and again to deal with it. They are dealing as well with the Telus Health issue, Honourable Speaker, which I, Honourable Speaker, referred to them because I take that issue so seriously. It's why we are in, Honourable Speaker, a province of laws, which means the Medicare Protection Act in these matters is enforced by the Medical Services Commission. And, Honourable Speaker, no one would want it any other way, Honourable Speaker. But what we're doing, Honourable Speaker, in particular in important ways, is, Honourable Speaker, to improve the public healthcare system. In particular, Honourable Speaker, in services that people used to have to go and get private care for. When under the previous government, we only did 174,000 MRIs in 2016-17. Honourable Speaker, what that meant for people is they had to go and get private care, pay for care that they should have been getting in the public system. And that is why, Honourable Speaker, we increased the number of MRIs in the public system by 120,000, purchased private MRIs, and improved care for British Columbia. And we're going to continue to do that.